Welcome, everybody.
Welcome, everyone. We will wait for a couple of minutes to wait for others to join us as well, and then we will start.
Maybe everyone can turn on their cameras as well as they're joining. It'll be nice to see them.
Yes, please, everyone, turn on your cameras. And also, I think it would be nice if you can type in on the chat your country, your organization. Yeah, this way everyone can get to know each other.
Shamli, can you make sure that everyone is able to turn on their cameras? And because sometimes we have to give them the permission to do so. And I don't see the others, so maybe we can change the view so everyone can see everybody. Yeah. And while you're doing that in the chat, I'm not able to text all the participants or see the participants' chats either. So if that can also be managed, that would be great. Mara, are you able to see the participants? I'm not.
Not really, because it's a matter of settings. So because we as the moderators spotlighted, we cannot really see the participants. I think we will wait for 2 more minutes for people to join, and then we can start.
Mara, can you, I can't see chats from the individuals. Normally we can see the participants typing in the chats. Can you turn that on?
Yeah.
I'm just checking. Can anyone else see the chats for the participants?
No, I can't see the chat, but I do see some comments in the question and answer section.
Yeah, that's just, I think, internal with the hosts and panelists.
Prof, the setting is so, I believe. I've sent you a screenshot on WhatsApp. please check that.
I'm not sure if I can change. Okay, let me see if I can. Well, let's quickly solve that first. Mara can look into it.
Yes.
Because that's the only way the participants can communicate with us. Okay. In fact, Mara, while you're doing that, why don't we launch the presentation? Okay, so we can, I can start speaking and you can solve that issue.
Yes. Oh, now I can do it. 1 second. Okay, now it should be fine. If somebody can type in something on the chat so we can see.
Yeah, for everyone.
It
Yeah,
works now.
I see.
Perfect.
Good. Okay.
Okay.
Good, they're able to.
So I will start. Good morning, good afternoon, and good evening, everyone. And welcome to today's webinar on youth leadership and innovation in global health and how to plan your international career in the health sector. This session is co-hosted by Empower School of Health, UNITAR, the Permanent Mission of Barbados in Geneva, and UNITAR Health Sierra Leone. Today's discussion will explore international career pathways in the health sector, the growing importance of the interdisciplinary skills in global health, and of course, the role of youth leadership, innovation, and international cooperation in strengthening health systems worldwide. We are delighted to bring together distinguished speakers from diplomacy, global health operations, and international public health leadership who will share both their professional journeys and their perspectives on the evolving global health landscape. Now, I will like to introduce our one of the speakers and our moderator, Professor Paul Lavani. Professor Paul Lavani is the founder and executive director of Empower School of Health in Geneva. He's a global leader in public health capacity building, supply chain, pharmaceutical workforce development, and also a former UN diplomat. Moreover, he is the founder and executive director of the Empower School of Health and has more than 30 years of experience in public health. He has a strong focus on strategic advisory, capacity building, and health systems that strengthen across Asia and Africa. Some examples of organizations that Paul has supported include the Ministries of Health of more than 30 countries, the Gates Foundation, President Kufuor's Foundation in Ghana, the Global Fund, and many other UN agencies such as the WHO, UNFPA, UNICEF, and the World Bank. Then I will briefly introduce myself. So I am a project officer within the Division for People and Social Development in UNITAR, Geneva. I have an academic background in international relations, diplomacy, and business administration, and my work has mostly focused on global governance, sustainable development, youth engagement, and international cooperation. Before I joined UNITAR, I also gained some experience in diplomatic institutions, more specifically the Romanian Embassy and the Romanian General Consulate in Paris, France. I have also a pretty active background in participating in international youth forums, leadership programs, and other empowering initiatives across all over the world. Thank you so much. And now I will let Paul guide you briefly to our agenda.
Thank you so much, Mara. And everybody, welcome again. And it's really an honor and a pleasure to host and moderate this particular event. We've got some excellent speakers with a very interesting and unique background. And we've launched this series of workshops that we're going to be doing, the webinars, which will lead to a workshop in Geneva, and we'll talk more about that later on. And our speakers today come from Africa, from the Caribbean, and of course from Geneva. You've heard from Mara already, and myself. I'm based here in Geneva. The flow, as we always do in these series, I make some opening remarks, and then we run into and we do a poll to get an understanding of who the participants are, where they're from, their backgrounds. It takes about 3 to 4 minutes to complete. And we'll close with a poll as well at the end. Subsequent to that, I'll moderate the session with Miss Vicky Blackman, very interesting background, and the same thing with Miss Bella Mikangi as well, before we bring to a close. But we definitely have a good time and session for the Q&A. Now, this is really about supporting and guiding young careers. So keep your questions ready as you're listening. Think about everything that is directly relevant to you, put them in the chat, and the speakers will comment on that. And there's a good chance many of the other participants would also comment and be able to guide as well from their experiences. It's not just from us to you, it's all of us together. We had more than 600 registrations. I'm expecting that the number of the count will go up as we continue to speak. All right, next slide, please.
Yes. Before we begin, I would also like to emphasize what Paul said. We will have a dedicated Q&A session towards the end of the webinar. So if you have any questions during the session, please, we encourage you to submit them through the Q&A function at the bottom of your Zoom screen. And also, I have a small game for you, let's say so. It would be very interesting to hear from you, and if you would like to type in the chat, which do you think is your superpower? Okay, so now before we begin, I will put on the poll, and we will appreciate if you would take 2 or 3 minutes to complete this. This will help us better understand where you're joining from, your background, your interests, and it will help us tailor our activities accordingly later on. Okay. I think you should see it now.
Yes, we can.
Perfect. Okay, so I already see the results. The people are typing in. It's good.
So Mara, when we have about 50 to 60%, we can just close the poll then, yeah.
Yes, of course. It's wonderful to see that we have participants joining us from all over the world. Right now, I can see more than half of the participants are from Africa. 60% are female, the rest male. We can see lots of students in early career health professionals, which is very interesting and very, very good for us. Academia, government. Very 5% of people working in public health and health systems, also followed by community health and health education. As I said, lots of early careers. Not very familiar with the international career opportunities in the health sector. Well, good news, that's why this webinar is for. And I think this will help you. Primary objectives to understand international career pathways.
Mara, what percent have voted already?
40%.
Okay.
I
So
will
just,
just leave it
then
for
you
like
can
30 more seconds and
that's
yeah.
fine. So yeah, when you share the screen, then it becomes good as well. Then we just scroll down and people get to see that as well. Okay.
Yeah.
I mean, share the Zoom results, that is.
Yeah. Interesting. Thank you everyone for participating. We're over 50% full. I will close the poll now. I share the
Okay.
results as well.
Let me run through this. This is great. All right. Thank you. So the African continent, 67%, Asian continent, 16%, and then we have a scattering from across, which is great. And congratulations, the first time we have more women than men, 51%. And even in this speaker profile, I think I'm standing out as the only man. So it's like more, I'm only 15% in terms of gender. And just to give you a sense, when we started doing this about 7, 8 years ago, women were only 25% of the cohort, both in our education and in the webinar. So this is really good to see 50-50. It's wonderful. Which stakeholder group best describes early careers? That's exactly the right target. So this would be really useful. Listening to Vicky, listening to Bella as we move forward, it'll be excellent. And this is good not just for the participants, but even many of our panelists and organizers at Empower, at UNITAR, are youth and are looking to grow in this area as well. Something I'm going to highlight later, but just make in the screen, you can see that there are several people in program management or government or academia and others. So coming from very different backgrounds, and we'll go more into that later on. Public health, health diplomacy, that's wonderful. New areas, health program management, grants management, finance. So the big ones here right now are public health and health systems and community health and education. And you'll see again that you can enter the health sector with IT skills, grant management skills, various others. You don't have to be a doctor or a nurse or a pharmacist. The majority of you have 5 years or less experience or are still studying and are familiar with international careers, have heard about it. And here, both the speakers have a lot of international experience. All right, wonderful. Let's jump in to the presentation. Thank you so much.
Yes, thank you so much. It is indeed wonderful to see participants joining us from such diverse professional and academic backgrounds, and many of you are interested in public health, international organizations, and I really think this webinar will help you. So with that, let us officially begin today's webinar. It is now my pleasure to introduce our first speaker, Ms. Vicky Blackman. She is a seasoned public health professional and currently serves as health attaché at the Permanent Mission of Barbados in Geneva, where she oversees health and social portfolio matters within the multilateral environment. She has more than 30 years of experience spanning acute care, community health, regional training, and international capacity building. Also, her work reflects a strong commitment to equitable and people-centered healthcare systems. She began her career as a registered nurse, and she later advanced her studies in public administration, management, and public health. and has consistently championed inclusive health education, community responsive approaches, and international public health cooperation. Her experience uniquely bridges frontline healthcare realities with global health diplomacy and multilateral engagement. Today, she will speak on the topic from public health practice to global health diplomacy. Ms. Blackman, the floor is yours.
Thank you indeed.
So Vicky, as you get started, I really wanted to emphasize, and as we do our Q&A moving forward, I think that slide really captures everything and how you transformed. It's wonderful. So I will let you speak, and then I've got a few questions, which I'm sure the audience would love to hear the responses to, which will also guide them. You've seen the profile of the participants. So the floor is yours, Vicky. Thank you.
Thank you so very much, Paul, and indeed to both UNITAR and Empower Health for this opportunity to just share a bit about my journey. My journey into health did not follow a straight line. It began with something much simpler, a love for people. I originally, when I was thinking about a career path, I wanted to be a teacher, I wanted to be a social worker, and my third choice was nursing. But somewhere along the line, I realized as a nurse, I get to be all three. I get to teach my clients, I get to interact with them from community health with directly and connect them into social services. So I would say indeed it is, the path began quite low. My first love led me into nursing. I was 18 years old. So, and there was just this desire to help, a desire to care for persons. At the acute care hospital, I then transitioned into community health. I must say that my passion was oncology. There was something about assisting people in that end of care life that I really wanted, and I felt like this is what I wanted to do. But again, another turn happened along the way, which then transitioned me into community health. In community health, there was now I was not seeing the patients in the bed dependent upon the nurse, but in the community, I'm seeing a well person that engages with the public health system when there was a need. So the focus shift there a bit. Whilst there, I transitioned into midwifery. I mean, can you believe it? Being at the beginning of life, helping that mom and that family with this little one growing on the inside and just assisting them navigating how to care for this newborn. Following on public health, within public health, which is epidemiology, there was Zika, which impacted both the newborn and the mom. Then there was chikungunya. So there were all these new and emerging diseases that led me into a regional aspect. I went to other neighboring Caribbean islands and I trained midwives and pediatricians on how to assess the care for the newborn. So this indeed was a very passionate topic, just to see how a conversation, how assisting a family can improve their life. We spoke about it not being a straight line, which then led me to the UN. My husband became our ambassador for Barbados to Geneva. So it was a full struggle because I was quite happy with my career, where I was at. So I had to then shift and change focus because I felt this was an excellent opportunity for my family, indeed for my husband, for my daughter, but my professional self struggled a bit. But whilst here in Geneva, the opportunity came for me to work within the UN system at UNITAR, where I was responsible for the breastfeeding education initiative, road safety, and impact on health and development there. Once again, there was a shift. Which then led to health diplomacy. So recently, I began at the Permanent Mission of Barbados as the health attaché, now directly responsible for policy. And I've seen this full circle. So in our nursing profession, we hear about, okay, these are the policies set out by the World Health Organization. Now, here I am, some 30 plus later, directly engaging with the World Health Organization, directly building partnerships, shaping policy. So I'll pause here for a bit, Paul, in case there's any other areas you would like me to touch upon, but really just to say that it need not be a linear journey. There are several ebbs and flows throughout a career path within health.
Excellent. Vicky, really unusual, very interesting. And I really like the way you presented your slides, and that showed the life journey. And the other aspect that you said from oncology, end of life, to beginning of life. Again, yes. Fascinating, really interesting. And then we don't always plan our journeys. Often the universe plans our journey for us. And here, your significant other decided to pick you up, move you to Geneva. And so you had to reinvent yourself.
Indeed.
And which you did. I mean, you stayed in education, related field. But then the question that I have for you is, in your current role, which you've joined recently in the Permanent Mission, you are acting in the role of, it's definitely diplomacy. It's working very closely with, we met recently, your Minister of Health was there, your ambassador is there. Yeah. So how does a nurse midwife transform herself into such a critical role from a health diplomacy point of view? So how did you reinvent yourself?
And so it's important to, again, not be static and that's life. This has nothing to do with health or anything. This is life. It was international, so adding international courses to my portfolio, international relations, foreign policy, to be acutely aware of what is happening within our nations and then influencing policy here at Geneva, at the heart of international diplomacy. And I think it also has to be the reverse as well, Paul. It is now that you have it at the macro level. This is the policy for the globe. How do you translate that to the elderly person at home? How do you translate that to the child at school, to the average man in the street? And I think this is where health diplomacy comes in, to help link and make the dots for ordinary citizens. So it's just not in the boardroom. It's just not at policy level, but health impacts at every single level, and to ensure that we get that message across.
Perfect. I'm just going to emphasize a couple of key points that you said, and then I'm going to switch to Bella and then come back to you. So we keep the conversation flowing. Continuous learning, continuous growth in an environment that changes, whether the change is created by you or your environment. And as we know that global health is going through significant changes, digital health is being introduced, which will create so many new jobs, but it's taking away some jobs. So wherever you're working, there will be change. There will be more people coming in, less people coming in. There would be more funding, less funding. There would be a different role. So like you said, adapt, learn, and make sure that you keep growing.
Indeed.
Thank you for that. Very useful. Let's switch speakers. Bella, let me give you the floor And I think you have a slide to present to begin with.
Yes, but
And yeah,
before we
actually,
move,
and
I would like to kindly introduce her to our
oh yes,
participants.
of course. And sorry, Vicky, did you have a quote as well, or is that for later? Oh, you're on mute.
It can be at any other point, but
Well, since we had the slide open, let's go ahead and give you the floor so you can
sure.
please go ahead.
So this quote was in the heart. So back in 1998, this was in our skills lab. For it may safely be said, not that the habit of ready or correct observation will itself make you a useful nurse, but that without it, you shall be useless with all of our devotions. And this came from the lady with the lamp, Florence Nightingale. And it speaks, yes, to observation of the client, but I took this in every single aspect of life. You need to be observant. You need to be aware of what is going on. You need to read the room so that you can be able, it can be family, it can be in the community, has nothing to do with health, but being observant. This has led me and followed me throughout my
Beautiful.
career and personal development.
Beautiful. I really like that.
Thank
Thank
you
you.
very
Thank
much, Ms. Blackman. Thank you for sharing those valuable insights and reflections with us. Thank you. Now, to move forward, I would like to introduce our next speaker, Ms. Bella Wanjiru Mikanji. Ms. Mikanji is a seasoned organizational development and grants management a professional with over 30 years of experience supporting donor-funded programs across sub-Saharan Africa. She currently serves as finance and operations lead at Youterus Health Sierra Leone, where she supports organizational finance and organizational strategy. Her professional experience spans across multiple countries in Africa, including Kenya, the Democratic Republic of Congo, South Sudan, Tanzania, Liberia, and Sierra Leone, among others. She brings deep expertise in institutional capacity building, grants management, compliance, operations, and organizational development, with experience working alongside major international donors such as USAID, the European Union, FCDO, the Gates Foundation, and the Swiss Agency for Development and Cooperation. Today, Ms. Mikanji will discuss about global health careers beyond clinical roles. Bella, thank you for joining us today. The floor is yours.
Yeah, thank you very much. If I may start, Paul?
Yes, Bella, you're most welcome. And with that introduction, do you want to start with a slide or do you want to start with a Q&A?
I didn't per se have a slide, but so I'm just going to talk through. I'm happy to start with how I got into this career.
Okay, so just before you jump in, Bella, then let me make some opening remarks, okay?
Okay.
So your background is, first of all, fascinating. And almost everyone believes that to enter the health sector, you need to be a health person, whether it's in life sciences, chemistry, biology, something simple, or a professional or allied health professional. So what I want the audience to know that beyond, and this is being recorded, this will be shared by participants to others as well, is there are so many entrants that come with non-health background and are needed desperately in the health sector. So your journey, and as you speak about, one is the journey that you actually did, the actual mechanics of it. But also, if you could mention somewhere the turning point of why the health sector was attractive to you and why you joined it. All right, thank you.
All right. So for me, it's quite direct, and I like the statement that you mentioned. You said when you were when it was Vicky speaking, and you said sometimes the universe decides for us. So my story begins where, like, growing up, I was always clear what I wanted to do in life. I knew I was going to be a doctor. I was so passionate about being a doctor. My grades, my grades at the time, I was like in my schooling, in my primary and in my high school, like they would agree, like I would get into the medicine. So for me, it was a guarantee. I was sure about myself. So I did the high school exam, and I knew, okay, the results will come. I'm going to get into the university, the government program. And when my results came through, I didn't make the cutoff points to get into medicine under the public sponsorship, the government sponsorship program. So, and I couldn't go with the private sponsorship because at the time it was so costly. So it was quite a sad moment for me, and I didn't know what to do. I was absolutely confused and I was sad. And though my grades were not bad and everyone was like, oh, you did well, but deep in my heart, I was crying. But outside, I had to show the face of like, oh, okay, I did well, but I knew I had not done what I wanted, what I expected to do. And I had a conversation with my mom, and my mom said, I know everyone is congratulating you, and I'm also happy for the grades that you've got, but I know that those were not the grades that you've got. And it's okay, whatever course that you decide to take, you can make something out of it. So I had to pull myself together and get into the university with the government system, which is what we could afford at the time. So I went into the university and started doing social studies. So I did a Bachelor of Arts in sociology with a minor in philosophy and literature. And this actually, I learned to love it and I learned to enjoy it. And it also, it also appealed to me because of my nature of loving the society, loving the community, and the need to want to help. Yeah, so that's something that is inborn. So it was able to match. So being at the university, there was, I came into contact with an NGO by the name I Choose Life Africa, which is an NGO that largely dwelled on HIV and AIDS. So I became a volunteer as a student. So here I was enjoying my course in sociology and philosophy, especially philosophy, though my major was in sociology, but I did take a lot of interest in philosophy. It's a very interesting course to study. And then at the same time, I'm participating in this NGO that focuses on HIV and AIDS. And this is at a time when the numbers are so high, when the story has to be told, when the information has to be let out to the people, and through this, you also learn, you learn to understand the disease. You learn how to help people to protect themselves from the disease as well as take care of themselves in case they have, in case they have contracted the virus. So in this case, I felt like I am in the health sector. So this went on all the way until I finished my university. And then luckily, the universe again streamlined things for me. I ended up in an NGO a few months after completing my university. I was lucky I did not stay out long. So I joined an NGO that was a media development NGO that focused on amplifying local voices. And in this space, we were in the space of diseases that really, really, affect a lot of people. So I had to deal to support with diseases on HIV, malaria, and even up to Ebola. If you can all remember the time when in DRC there was like an outbreak of Ebola. So I felt comfortable. I felt, yes, I am not the doctor that I wished to have become, but I am still in this space where I can help the people, but from a different perspective in terms of from an administrative perspective, from an HR perspective, from a finance perspective, because the health sector itself does not stand alone. It needs all these other sectors to support it. It needs these other sectors to create a system that is able to support the health sector itself. And so this is how I ended up in that. And then I did a master's, I went ahead to do a master's in business administration, which I believed is going now to be streamlined with what I was doing. And yeah, and that is how all along I've been able to support in this health sector up until now, where I work. I'm supporting, again, the health sector on uterine health under the Youterus Health organization that I work for, which is a company that focuses on the uterine health with regards to women.
Really interesting, Bella. Thank you for sharing that. Um, what is, again, lessons that I take away from this, and it reminds me of something that reminds me of my youth when I was studying. So I was studying pharmacy, and interestingly, unlike the two of you, it seems that it's very deep in my DNA. My grandfather studied pharmacy. My father studied pharmacy and chemistry. So I don't think I had a choice. Although my two brothers did economics and accounts, I ended up studying pharmacy. But what's interesting, in the United States, we were forced to study sociology, anthropology, and some other electives. You had to take courses outside the mainstream pharmacy. And I thought it was a total waste of time. But in reality, those courses, just the way that you said, the philosophy, literature, social sciences, were really valuable to you. Similarly, anthropology, sociology really opened my mind in terms of the work that I was doing, not at the time in a manufacturing facility or in a hospital pharmacy, but much later when I joined the UN and I was working for WHO and the Global Fund. That's when I was able to apply some of those learnings. I have one more question for you, and then we'll go to a little bit of Q&A and then come back again. Is how, and sorry, one more point related to what you said, wanting to be a doctor and ended up being in global health, public health, having um, having an effect not on a one-to-one basis, but on one-to-many basis. So you're not treating them, but you're helping support the whole public health system or even the global health system if you're in multiple countries. And there are many doctors, and I know this is not a surprise for you, who started off in clinical care. And also, you heard from Vicky in nursing, one-to-one care. And they really enjoyed it. But they realized they could create greater impact if they could work in a global health environment where they're creating impact not just for one person at a time, but many people at a time, hundreds or even thousands of people. So, in fact, what you ended up doing, and you should feel really good about that, is that you are addressing a need in large volumes as opposed to one-to-one. And my question is on how, and I'm sure the youth would be very much interested in that, and the people who are present. How did you network? How did you reach out to people? How did you get these positions? We heard the phrase "read the room" from Vicky. Was it relationship building? Was it lots of applications? Was it hustle? Was it knowing what you wanted and connecting with the right people? Talk to me more about how these individuals who are looking for their next, let's say, talk about early career or fresh graduates, and as we grow, what approach did you use that was, would you say, the most effective? You tried a bunch, and what was most effective? And then I have the same question for Vicky as well. And then I have another comment later. Over to you, Bella.
Mm-hmm. So for me, I would say that one thing that I believe is very key and that can work is putting yourself out there. You know, when being out there, when interacting with people, speak about your interests, speak about your love, speak about the journey that you've already taken and what you anticipate to take in future. Because when people go back to their spaces, people have discussions. People will sit down even 1 year later and remember, oh, I met someone called Vicky 6 months ago, and she was talking about XYZ. Why don't we engage her? So
Right.
if you make sure that your story, your interest, yourself, stays in the minds of people, and in the minds of people, especially those who are in line with what you want to achieve for yourself and what is your goal. I think that is very critical in terms of making sure that you will probably end up, you increase your chances in ending up in being called to a space that you want to be in. Because the truth also is, in today's world, like so many people, would want to be in the same position. For example, we've seen, I'm sure you've had the same experience where you want to recruit someone and then there's like 500 CVs, yeah? there is a chance that your CV
Yeah.
will be picked out. There is a chance. It is not a 0%. But if your name is in the minds of people, so when people
Right.
are creating these things, they will think about you. And then I will also say in the NGO sector, in this global sector, many a times there is emergency work that is needed. So say, for example, right now, with the Ebola outbreak that is ongoing in the DRC. So there's need for an emergency response. So when there's need for this, people will think of, okay, we need to bring people to come and support with XYZ in this response. So who do we know? If you have not exposed yourself, if you have not spoken about yourself, then people do not have you in mind. So what I would say, no one should be shy or feel ashamed or, insecure about speaking about themselves, their interest, their career path, where they want to go. And even if it's a part of like you've never worked, like you're coming fresh from school, yeah. And I will say, even in my first job, like I said, I didn't stay out of work for long when after I left my university, yeah, which normally in Kenya, and I believe in many countries as well, people can even go up to 2-3 years before they get employment. But why? Because when I was in the university, as I was doing my volunteer work, part of what I did is I put myself out there and I kept reminding people, now I'm finishing school. This volunteer work is attached to, the area of school where I was, and now I'm coming out. I'm going back to the city. Hey, if you know, I want to continue in this path, and that is how I ended up in the sector right after school. So put yourself out there.
Yeah, Bella, beautiful. I mean, put yourself out there. The flip side to that is, and what people should take away is be prepared to be vulnerable. Be
Yes.
prepared to be rejected. It's absolutely fine. Rejection doesn't mean you're not good enough. Nothing changed. Rejection only means that there was no alignment with that individual, with that organization at that time.
Yes.
But there've been instances where I was rejected by an organization only for them to say, "Could you reapply in a year's time? It's there. We don't have that position, or we don't have that project, but we need to work with you. We want to work with you." So absolutely, put yourself out there. It's okay to be rejected. In fact, there's a wonderful story on TED Talk where this person was so scared of rejection, so he forced himself to come up with 30 rejections a day. He would go do something and get himself rejected until he basically desensitized himself to rejections. And then eventually he was absolutely fine to put himself out there. The other part about tell your story. And it's really linked with the question that we put in the chat as well. What is my story? What is my superpower? What is unique about me that everyone will remember once they've gone home? And this is really important to balance between, you're not bragging about yourself. You are telling about your unique features or aspects. And again, you might be young, but that's fine. Doesn't mean you have to have achieved something. I haven't won a Nobel Prize, but I can still say something unique about myself that would be interesting to others. So whether that is you're a really good connector or a speaker or a storyteller, or you're really consistent and quiet, but you work hard. What is your superpower? What is your unique feature that you want to communicate to others? Bella, thank you for all that. Do we still have Vicky?
Yes, I'm
Vicky,
definitely
over to you.
here.
Yeah,
So
please.
I definitely agree with what Bella said. Social connections are key, but also from a practical standpoint, when you fill the job applications, it is important. There's so much we want to put in our job descriptions. We want to put in the application form, but know that the hirers are looking for key things. They will weed out your application will be rejected if you're not using these keywords that they are looking for. So
Right.
you must ensure that they are. So part of putting yourself out there, part of this social connection is knowing how to prepare well for the application process and also for the interview. And I'll say this, for me at home, being a nurse, it was just going through, you get a new qualification, you're promoted, because I was in the public setting.
Right.
Transitioning now to the international setting, it was now applications. This was new. I never had to apply for a job before. So what do? I had to retool. I actually got the assistance from a recruiting agency to walk me through this process of job interviews. Because again, at home, we did the training because nursing is such an essential service. You are automatically placed within a job. So exiting my safe space, exiting my comfort zone.
Right.
Here I
Right.
am in an international setting. Retooling is important. This has nothing to do with skills. This has nothing to do
Yes.
with whether you can get the job done. It's how to get into that room. How can the employer get that your CV in hand? And it is knowing how to respond to these job description questions, how to respond within an interview, how to be prepared for that. So there are these practical things as well, that I think is also important, along that goes hand in glove with social connections.
Indeed. Wonderful. Vicky, Bella, thank you so much. Very useful. I'm going to switch. I'm conscious of time, want to make sure that we finish mostly on time. Can we jump back to the presentation? And I'd like to share a few more key elements with the colleagues here. I think there's a quote. Yeah, go ahead, Bella. Is this is this yours?
Yeah, this is my quote, and I love this quote. And I came across it back when I was a student of philosophy in my undergraduate. So it is by Aristotle, who's also known as the father of Western logic, and also Aristotle also spoke a lot about ethics. And it says, "We are what we repeatedly do. Excellence then is not an act, but a habit." So if we want to be good in what we do, we have to do it repeatedly over and over and over. And then it becomes a part of us, a part of who we are, a part of how you can describe yourself.
Wonderful. Very useful. Totally agree with it. And that's what we all need to live with. And it's, again, cross-cutting. It's not vertical. It's not about what we know. Next slide, please. Next. So to give you all a sense, we've got people from all different sectors, health and non-health, but interested in the health sector. So there's a shortfall of almost 11 million health workers. And we're just talking about allied health workers and health workers. The other areas, if you bring in finance and finance management, monitoring and evaluation, data and everything else, it's much more than that. Knowing that it's there, and that too in many low and middle income countries. And you can apply this in pharmacy, in nursing, in physiology, any area that you're actually working in or are interested in, maternal child health, infectious diseases. Next slide, please. And the problem that not just students, but let's say early careers and people in mid-careers who are looking for, what's next? What should I be focused on? And in today's days, my children are 21 and 27. They know, and they have been reinventing themselves every few years. Whatever skills they learn today, they know they're going to be obsolete unless they pick up new skills. So they're adding new components. So if you're a doctor, pick up public health. If you're in climate health, pick up One Health or pick up data management. Keep learning for you to grow. But the question is, which pathway? What do I choose? There's so much out there. And data and knowledge is doubling every 7 to 8 months. and now it's even faster. So how do I know what to learn, what to study? This is, of course, dependent on what your interests are and what the industry is doing as well. Next. So different health careers, you can search these up. Here are some examples of what they are that are needed in private sector and public sector, in global sector as well, whether it's in the UN, whether it's in your Ministry of Health or the private sector in your country. Every country, the private sector or the health sector in general is growing at over 10%, somewhere between 7 to 20%. Populations are aging. New children, and if it's in countries and continents like Africa, there's a lot more, there's a higher fertility rate. You've got other components that are needed: family planning, reproductive health, infectious diseases. We have that pandemic or the Ebola epidemic that's back that we need to address. Lots of options. Supply chain is another area. Biggest challenge, what I was managing at the Global Fund, with a healthcare background. They're actually two different things. We have supply chain experts who come from logistics. They learn health. I came from a health background and learned supply chain. So again, bring those complementary skills. Next. So what are some of the options? How do we get there? Next slide. And we heard about this from both the speakers, it's not just about what you know in medicine, in those vertical areas, in the sciences, etc., but your analytical thinking, adaptability, communication, collaboration, cultural intelligence, emotional intelligence, leadership. So these soft skills, or let's say cross-cutting skills, are needed for everyone. And how do you develop them? Join different groups, join different associations, join a speaking club, make sure you're present. And many of these things cost nothing. But again, going back to what one of the speakers said, put yourself out there. It's absolutely fine. And this will help bring it there as well. Next. I would say it's not there, but learn a new language. The more languages you learn, the more jobs you'll get. I guarantee it. Mara, how many languages do you speak?
Currently, I'm working on my fourth.
Currently working on the fourth.
Fifth.
Okay.
Sorry, fifth. Yeah.
Sorry, fifth. All right. See, she's forgotten how many languages she knows. Okay. And majority of us, on the African continent, Asian continent, we would know probably one or two. One would be, let's say, our native language, our national language. One would be probably English or whatever the legal languages of the country. So most of us probably know two, but you absolutely need the third and the fourth. Learn, expand your opportunities. And it's never too late to learn. You've got free options available. Build an international career, both at the country level first, and then in your country, there will be international organizations. You heard from Bella how she did that. Okay. In the case of Vicky, it was different. She was picked up and moved, and then she adapted. Okay. In my case, I had to pick myself and move and hope for the best, right? So there are different ways of doing it, but gain the exposure, build your networks and visibility. Next. And to support you in this, we actually have a 5-day career workshop for those who can actually make it. We'll share the details. Please put the link in here, if you will. UNITAR and Empower. We're partnering, targeting youth, 18 to 30-year-olds. It's happening in Geneva. It's for 5 days. 5 days in person, but you begin even before online. And then you continue afterwards, after this is done as well. You'll meet global experts. You'll get real-world exposure. You will go visit UN agencies, from WHO to UNITAR to Médecins Sans Frontières to various other, the University Hospital Group. So people with different backgrounds really get to hear from the experts, both from a disease or a vertical specialty and for all the soft skills that we talked about. We will help you build your career pathway. So you'll actually have, by the end of it, a career plan for yourself. So if you're between 18 to 30, a couple of years here and there, it's absolutely fine. And then we'll break you up into different groups while you're there as well. Next. And it's from, sorry, I forgot to mention, August 17th to 21st. Okay. And more details about who should apply, what makes this unique, why Geneva, and why Switzerland. Let me just mention that I know it can be challenging to get here. There is a cost issue and there is a visa issue. And we've, in both cases, from a visa point of view, because we're applying the letter for coming would come from both UNITAR and Empower, and a UN agency makes it easier to get the visas. But that is a challenge for sure, and we need to work with that and work on it earlier rather than later. There will be people from Europe, from Switzerland, the Americas. So really, it's a global conference, and it's an annual event that is taking place. Next. As I mentioned, it's before the workshop. There's activities you'll be working on during the workshop and then post, and the different skill sets. You'll get to read this later. Next. And finally, in terms of the speakers and experts from different areas, Vicky is based in Geneva. If she doesn't go on holiday, she will be one of your speakers. So make sure you get to know her already and you know her network. Yeah, I hope you heard what she said. So you know it's someone you have to meet when you come here. And if you tell her that you heard her speak at this event and you were really impressed by her, because I'm impressed, I'm sure you all are, she will listen to you, right? There's already a connect, okay? So UN officials, global health leaders, industry professionals from global and from Europe and Switzerland will be there. Youth leaders as well. It's not just us, or me, I should say, older people speaking, but listening from youth to youth. How did they succeed? How did they, what's Mara's story, for example? Okay, how did she's working in the health and education sector. She wasn't expecting that. She was working in a Romanian consulate in Paris. And here she finds herself learning a fifth language and talking to health professionals. So come talk to her. You'll get to meet her when you're here as well. And so different folks from different areas, you'll get to visit all of these, and then from a contact us, there all the details are there. Next. All right, wonderful. Yeah, go ahead, Mara.
Sorry, Paul.
Okay.
Let's now move towards our interactive Q&A session, and I would like to thank everyone who has already submitted questions through chat. It's really wonderful to see such strong engagement from all of you, and to see what everyone all from across different countries and across different professional backgrounds wants to ask us. So I would kindly ask you to move towards the Q&A section that you will find below, and I will let Paul, Bella, and Miss Vicky to answer all your questions. Thank you so much.
Let me take the first one, and this has come up before as well. Why is age a barrier? Absolutely, I totally agree with you. Several people have, in fact, already asked us to reconsider. So I think we need to, just the way we have a statement, we encourage 50% women participation, we should say we encourage youth participation. And let's not make it a barrier. So let's make it an encouragement, but not a barrier, because the youth will also benefit from speaking to people. 31 is not just because I'm 31 years old doesn't mean this I shouldn't qualify to come here, right? So yes, let's definitely consider that. I see someone's about to learn Chinese. Yes, indeed. Well done. Not easy, but you've taken on a challenge for yourself, and it's a very good language to learn. Yes, so speakers, please pick a question that you see that you'd like to respond to.
I'll respond again to the question about how to assist more from a intervention standpoint in what's happening with the conflict alongside the Ebola virus in the DRC. It's always challenging entering into a conflict zone. But then when you add a public health emergency for the area where the consequences is death. I think we need to speak to community leaders because going into this scenario, coming out, it's challenging to just come in and say, I am the UN, I am a doctor, I am a nurse, I'm here to help. But you always need to connect with community leaders. You always need to connect because the community can see you as an outsider. You know, you are coming into their space. So in order to get buy-in, you need to first, yes, with the healthcare, work alongside the existing healthcare system, but meet with the community leaders. They're the ones who shape what is going on the ground. So I think it's very important to start there. The conflict in DRC is multidimensional, but you need to attack it from a people's perspective. This is a life or death situation.
Very much so. Let me jump in. Bella, there's one individual who has a similar background to yours, is desperate to get to know you and connect with you later. So we will be putting our emails. I guess you'll have access to all our emails. Please do feel free to reach out to everyone. And a couple of people have talked about how do we get international positions and foreign jobs, etc. Bella, why don't you respond to that, and then we can always add to that as well. How did you end up working with an international NGO? You started off in Kenya, and now you're working remotely with Liberia, etc. So if you could just talk about that.
Yeah, sure. I do believe the first step is to allow yourself to get into the system. Yeah. And then once you get yourself into the system, because more often than not, you will probably start in your country of, you know, where you're based, where you're resident, or where you're a citizen, more often than not always the case. But once you're in the system, these foreign jobs, there's a lot of networking, there's a lot of opportunities that you get to be able, that allow you to do networking. So take advantage of this networking, and also within the organizations that you work for, try and also put forth soft skills. And, you know, soft skills, because you could be like the most, you know, talented person in, I don't know, IT, or, you know, you could do numbers with your eyes closed. But then there's also the other aspect of soft skills, like, you know, empathy, like, you know, communication. So these are some of the things, these are some of the soft skills also help to elevate you onto the next level. As much as you know you're very good in as much as you have very strong hard skills. So don't leave behind your soft skills, and also embrace networking. Go to these events, join these online events. Some of them are cheap, like free entry. I think even this one, there was no payment, for example, right? Right. Yeah. There is also other, like maybe cocktail networking events. So go to these events, and even in your organization, if you work for an international organization, but you're based within the country, put yourself out there, do a lot of volunteer work as well. I know there's also a number of organizations that put out volunteer work. So that's the other thing, Paul, I just wanted to mention, you know, back at some point when we were talking about you know, like entry to the job space. We shouldn't be afraid of work like volunteer work. Yes. Yeah. Because that also opens our doors. Or work that you know, like starts us off as at a low level. Those are fine. We build our way up. And that, for instance, for myself, that's what happened. Like first, like I said, I started as a volunteer, and I did volunteer work for, I don't know, 4 years of volunteer work where, you know, there's really no pay except maybe some lunch money and transport money. And then like, and the entry level, it's like from a low, you know, like from a really a low entry level. And then with this, so improving on my hard skills, but then also improving on the soft skills. Because some of these jobs out there, global, they need you to have this, especially things like empathy, communication. Those are very, very key. So those are some of the other extra things that you can do to be able to elevate yourself to other levels, which would include you being an expatriate, for instance.
Absolutely. Let me just mention one related point. When Bella talks about volunteer, I want to link it to the fact that when you interview for a job, you should not be focused on money. I know it's important. I know you need it. You need to survive. You need to grow. You need to put food on your plate, whatever your situation might be. But the focus on money comes later. The initial focus, and be prepared. In some cases, if this is exactly what you want to do, be prepared to work for free, because the education you'll get, because you pay for education, you pay for university. But why is it then not appropriate for you to pay or not receive money for your time invested in a company or an organization where you know you're going to learn the activities, build a network, and apply those skills? Think of it this way: you're getting free education in that place. It's not that you're not getting paid. So flip the mindset, especially when you don't have those skills. And if you bring up money too early, you won't get that job. That much I can guarantee. So balance that. And I know there are some nationalities or some personalities that focus on money right up front. It will basically spoil the relationship early. So please don't do that. And in terms of yeah, please.
May I just mention one thing, which I'm also a strong believer. I'm a strong believer in finding a mentor.
Yes.
A mentor will help you get to your career goal. And with every step, you will go, then change your mentors as you continue on in your career, but find a mentor. A mentor will hold your hand, a mentor will support you, a mentor will help you in your growth, because a mentor will also tell you the reality of things on the ground. So embrace the mentorship program.
Absolutely. And, a mentor doesn't have to be a minister of health. A mentor can be somebody who is nearby, somebody that you met, somebody that you respect, and the different kinds of mentors that you can grow with. Super important. Absolutely. Before I forget, for all the different people that are here, the August workshop in Geneva is looking for organizational partnerships to promote the visibility, and through those partnerships you also get a reduced enrollment cost as well. So check with your organization, check with the people that organizations you're working with, promote it across, because we know that cost is a factor. We want to bring the cost down as much as possible. We're also trying to raise funds from foundations to see if we can bring in people from low-income countries at less cost or even no cost. But we know that it's going to be a challenge, but we'll keep trying from that point of view as well. So if your organization is interested in that, please do so. And you can reach out to the email IDs from UNITAR and Empower on there as well. Vicky, any final, maybe there's a question here that you've seen that you'd like to respond to, or anything else you'd like to say before we bring this to a close?
Sure. Thank you very much, Paul. Indeed, what to do now? I always believe in planning. You asked earlier, what is our superpower? For me, is turning vision into action. Where do you see yourself? And this is a life plan that my husband and I have. In 5 years, in 10 years, in 15 years, and in 50 years, where do you want to see yourself? If you have an idea, when life intervenes, you shift, but the goal is still there. You turn, you adapt, but the goal is still there. So to answer the question, what should you be doing right now is building yourself, developing yourself. Everything Paul and Bella has said. Join a service club Leos, lions, whatever there is, but get involved with your community, whether it is a religious organization, a service, but get involved, give back. So you want to, obviously, money is important, as Paul correctly said, but you give of yourself, you gather, be a sponge. You take in, you observe what is going on around you, and you build as you go. I think being flexible whilst being courageous, whilst believing in yourself. Don't approach it with arrogance. You're never too old to learn. You're never too old to hear critique, and you take it as that. We spoke about rejection earlier. You learn from it. For every interview that you go to and it's a no, what can you take away from that interview? What can you take away from that experience and build on it towards every step. We look forward to having you here in Geneva in August. I think it's going to be a phenomenal experience towards just gathering more skills, gathering information, and building. And the ultimate goal is giving back to society. The ultimate goal is improving the health and lives of all of our citizens back at home.
Thank you, Vicky. I'm going to end with a story which transformed me when I was a 13-year-old. And it's very much linked to what you heard from the speakers as well. And so all my life, I had been a very average student, but excelled in sports up till the age of 13. And sports is still a major part of my life. And I was in all the school teams, and everything for me was about hockey and cricket and squash and badminton. And if I found the time and the energy, I would study just enough to make sure that I would pass and go to the next grade or the next class. Until one of the teachers, who was my badminton teacher, was also my chemistry teacher. And what he said was, if you can excel in one activity, you can surely excel in academia as well. And he said just once, and I respected this person, he actually helped me become, in badminton, I went from 0 to 100 and became the junior captain at a very young age. It was because of this person. And because of my respect, my mentor, as we just heard, he said, in the next chemistry test, just once, and I don't care what you do after that, I want to see if you can get an A. And I was like, okay. And he says, if you do, I'll do a somersault in class. I said, but you have a broken hip during World War II. You had hurt yourself. And he said, that's my problem. You get an A in class in chemistry for one test, and then you can go back to being average. No issues. I just want to see if you can do it. And sure enough, for the next 3 weeks, I really studied. I had never studied this hard before. My brain was hurting from all of that. And sure enough, I made sure. Actually, I didn't know if I had the A or not. But he walks in with all the tests in his arm, puts the test down, pretends to trip, falls, does a somersault, and gets up, and then winks at me. And sure enough, when I looked at the test, I had an A. And he says, it's fine. Let's continue playing badminton. You do what you want with chemistry now. Of course, I couldn't go back. And then I realized it was just with that one statement, with that one mentor, and those 3 weeks, I realized who I could be as well. So I got transformed during that very short period of time. And everything that has happened since, my inflection point, I relate to that, where someone believed in me, and then I believed in myself. So the message for all of you out there is, I've had plenty of failures as well, by the way. I would have said that probably 90% of my life is failures, which is absolutely fine. It's the 10% that really builds you. And there's a reason why, again, the universe didn't want to give that to you, or at that time. It'll come back. So like Bella said, she wanted to be a doctor, but the universe had a different message for her. She's still in that same space. So Bella, Vicky, thank you so much. Mara, thank you so much. It's been a really valuable session. Participants, Thank you very much. Mara, I give you the floor for the poll, and then we'll turn on the cameras. Hopefully we know how to do that, and we can see everybody as well. Go ahead.
Yes. Before we conclude today's webinar, I would also like to sincerely thank all of our distinguished speakers for sharing their expertise, experiences, and perspectives with all of us. And we will now pull up a post-webinar poll, 1 second, which I highly encourage you all to complete. It should be visible right now. Can you see it?
Yeah.
Okay, perfect. So I'll give 2-3 minutes for the poll to be completed, because your feedback is extremely valuable and will help us improve further for the next events and initiatives. So let's see. Also, for more information, I would highly suggest you follow Empower School of Health, also UNITAR, on all social media platforms. We will be sharing future events, future webinars, and yes, keep in touch with all the speakers. It's really important. Okay, the answers are coming in. It's really great to see that most of the questions regarding the understanding of how the understanding of international health has shaped the service webinar, most of the answers say that it's significantly improved. We're pleased to hear that. Highly relevant. Also, I can see a huge interest in the upcoming Youth Career Accelerators in Health here in Geneva that will take place from 17th to the 21st of August. And I encourage you all to participate if you have the opportunity to do so. We have an excellent feedback for the quality of speaker, which is great to hear. Miss Vicky, if you want to share your email in the chat, there are many people who are interested in having it. We have almost 50% of participants who answered to the poll. I will leave it for 1 more minute and then we can close it, look over the results for a little bit, and I'll let Paul have the closing words for that.
Wonderful. So if you could just share the polling results, and then
yeah, I will leave it until 25, and then
okay.
1 more minute. This is your chance to complete it.
There are still some people saying, how do I participate in the poll? But you're saying that people have participated already, right?
Yes, more than 50% already participated.
Okay, that's fine.
It
Okay.
should be down by the screen. It's a matter of settings. I'll close now the poll and I will share the results with you. Okay.
Okay, wonderful. Thank you. Significantly and moderately improved in terms of understanding of international career pathways. It's true because we didn't just focus on international career pathways. We spoke about everything. Because many people are interested in other elements as well. Was this relevant? Highly relevant, 80%, moderate, highly and moderately, pretty much 97%, which is great. So team, well done. We've talked about the right points and the right topics. What actions would you likely pursue after this? This is always very useful. Review and strengthen my CV. Seek mentorship or career guidance, absolutely. Explore internship, fellowships, and volunteer opportunities is another large response. Build professional networks. Research international health organizations and job pathways. Pursue additional training and education. And several of you are interested in applying for the Career Accelerator, and we'd be very happy to meet you over here. A lot of interest. About 65% said we are interested. So many need more information. Please reach out to the teams in UNITAR and Empower. Future support. In fact, it's almost 50% across all these areas. So we picked the right topics. And it's similar to what we had above. So team, these series, and just let all the participants know, this is one of a series of different webinars that we're doing, and we'll continue this until the workshop and probably thereafter, but really it's to build up so you understand. Today we had, you heard from Vicky and Bella, very unique backgrounds, and we'll bring in other speakers, some international, some national, different professions, some doctors, some scientists. So you get to really see all the different opportunities and options that are available to you, health and non-health. How would you rate the overall quality? Excellent, 85%. Good, 14%. That means we still can improve, team. We're there, but we're not fully there. And I want to talk to that one person who thinks we're only fair. Where did we not do well enough? So we got a tough grader over there. All right, so I want to know what he considers excellent, and so where we can actually learn from that person. And I would ask that person to type it in there. Where can we improve? So please tell us, okay? We can always do better. And would you recommend these sessions? Yes, 96%. Great. All right. Thank you so much. This has been a wonderful session. And yeah, Mara, back to you.
Yes. With that, I would like to thank you all once again for joining us today. And we hope to see you again for future webinars and programs. Thank you so much for all the speakers. It's been a pleasure. And I would like to wish you a wonderful day.
Wait, we're opening the videos first. Hang on, Mara. We want to be able to see everyone. How do we do that?
Yes. 1 second.
Also, Prof, and everyone, we would like to inform the participants that we have posted the link in the chat to generate the certificate for today's webinar. You guys can click on the link and generate your certificates. Thank you.
Oh, excellent. Yeah, thanks for the reminder.
I'm not sure we can see everyone.
No, but they should, let me rephrase it. Give the participants the permission to turn on their cameras. That's what we're saying.
They do have the...
Yeah. All right. So everyone, can you, I don't see them yet. They're not showing up.
I'm not seeing them either.
1 second.
Anyone else can help Mara to quickly do that? That would be great.
Yes, please.
Yeah, they're saying that the camera icon is not working. Yeah, we're going to unlock it in a minute.
It's supposed to be there. Allow participants to start video. Let me.
Or repeat, Shamli, if you know how it's done, please guide Mara. Or see
No,
if you can do it.
unfortunately, it's not possible. It's only possible for them to raise hands and to see the participant count. It's not possible for everyone to open their cameras.
Okay. Well, we'll figure it out for next time. There might be another way to do it because sometimes it works. Okay, that's fine. All right.
Thank you so much.
Thank you again, Vicky, Bella, team.
Thank you,
Bye.
everyone. Indeed. Have a
you,
wonderful
everyone.
day. Bye.
Bye.